So what is Huntington disease? This is a relatively rare disorder. So many people have not heard the name before. George Huntington is a physician who was working in Newfoundland and found a community of people with this disorder that he wrote up and described. So in Western literature, we still use the name. There's roughly 40,000 people affected in the United States. And because this is a strongly inherited disease, many more people at risk, people related to the ones we know are affected. Huntington disease is called a neurodegenerative disorder. There's a whole family of these. You may have heard of Alzheimer's disease or Parkinson disease. Neurodegenerative just means nerve cells are lost over time because they're getting damaged by whatever this disease process is. Huntington disease is also a movement disorder, meaning there's problems with voluntary and involuntary movements driven by changes in the nerve cells in the brain, rather than changes in the muscles or in the joints. So Huntington disease involves three key areas of symptoms that we look for. One is motor. People have trouble with both their voluntary movements, the stuff they want to do, and they also have extra involuntary movements. Old term for Huntington disease is Huntington chorea. Chorea is derived from a Greek word meaning to dance and describes one of the most striking movements that many people with Huntington disease have, involuntary, fluid, wiggling or dancing movement called chorea. Another area is changes in thinking or memory. A lot of different kinds of thinking are involved, not just memory, in cognition. So we talk about cognitive change generally. That means all different forms of thinking and how that may change or get more difficult for people. And then another area is mood and behavior. So all kinds of different mood symptoms, whether it's mild irritability or major depression, are possible. That's a pretty big list, 3 categories, and each of those 3 categories has lots of stuff in it. Everybody's experience is a little different. So while I tend to ask for a long list of different possible symptoms, each individual tends to have their own mix of symptoms, and it's pretty unusual to find somebody who has everything. All of these categories of symptoms do currently worsen over time, so things slowly get worse. We have a lot that we can do to manage symptoms and make quality of life better. Right now, there's a huge amount of work in how to actually slow down or stop symptoms from occurring. The last thing to mention in what is Huntington disease is that it is strongly inherited. We know the change we know which gene and we know the change in the gene that causes Huntington disease. So we can actually test people for that genetic change to confirm the diagnosis and use the knowledge about that mutation, that genetic change that causes a disease, to try to predict what might happen to other family members if that's something that they want to know. This is an autosomal dominant disease. That means that a child has a 50-50 chance of inheriting the mutation from the parent. If you inherit the mutation, generally speaking, you end up with the disease. We'll talk more about genetic testing and what that means in another chat.